Welcome to our video on abnormal uterine bleeding. Let's get started. Abnormal uterine bleeding, previously known as dysfunctional uterine bleeding, is classified according to the duration of the menstrual cycle, the amount of blood flow, and the timing of the vaginal bleeding. Additionally, we differentiate structural from non-structural causes of abnormal uterine bleeding. Structural causes are remembered by the mnemonic PALM, P-A-L-M, while non-structural causes are remembered by the mnemonic COIN. And we'll review each condition using that PALM COIN mnemonic later. But please keep in mind that these conditions are covered in great detail in other lectures. Let's start by classifying abnormal uterine bleeding based on the duration of the menstrual cycle. Polymenorrhea is a menstrual cycle that lasts less than 21 days. Therefore, the total number of menstrual cycles that a woman undergoes through her reproductive life is increased. In contrast, oligomenorrhea is a menstrual cycle lasting more than 35 days. So in that case, because each one is so long, she actually doesn't have as much time in her whole life to have as many menstrual cycles. So there would be a decreased total number of menstrual cycles in her life. Now let's talk about the abnormal amounts of menstrual blood flow. Heavy menstrual bleeding was previously known as menorrhagia. However, the term menorrhagia is no longer routinely used. But what qualifies as heavy menstrual bleeding? Well, this would be bleeding that lasts longer than 7 days. Also, you can diagnose this when the menstrual pad is fully saturated with blood in roughly 1 hour. And that's a nice rule of thumb to remember because you don't expect your patient to remember how many milliliters of blood flow they had. Just think in real terms. Oh yeah, I had to switch it every hour. So the menstrual pad is fully saturated every hour, then it's heavy menstrual bleeding. In contrast, vaginal spotting is an exact opposite of heavy menstrual bleeding, which is fairly intuitive based on the spotting, which makes it seem small. Well, vaginal spotting indicates scant bleeding with less than 1 inch of menstrual pad saturated with blood. Again, this is information that the patient can tell you. We will now discuss intermenstrual bleeding. Intermenstrual bleeding was previously known as metrorrhagia. However, that term is no longer routinely used, and you diagnose intermenstrual bleeding when a woman has a normal menstrual period with intermenstrual spotting. So normal menstrual period and then spotting outside those times. Now, menometrorrhagia is a term used to describe the intermenstrual bleeding that's accompanied by heavy menstrual bleeding. In other words, this patient has intermenstrual spotting, and instead of normal menstrual periods, they're really heavy. Now let's move on to the structural causes of abnormal uterine bleeding, which are remembered by the mnemonic PALM. Abnormal uterine bleeding can be caused by an endometrial polyp, which is the proliferative mass of normal endometrial mucosa that actually ends up protruding abnormally into the uterine cavity. Now, adenomyosis, another common cause of abnormal uterine bleeding, is an extension of endometrial glands and stroma into the uterine myometrium. Adenomyosis presents with soft, globular, and a symmetrically enlarged uterus. A leiomyoma, also known as a fibroid, is a benign, smooth muscle tumor of the uterine myometrium. And when you think of myoma, you can think of myometrium. And so if you're trying to remember what type of tissue that is, just remember this is myometrium. So it would be smooth muscle. So a leiomyoma is a benign, smooth muscle tumor in myometrium. A leiomyoma can cause abnormal uterine bleeding, which is why it's part of this mnemonic, but it also presents with an irregularly enlarged uterus. And that makes sense because fibroids are just going to pop up in different places of the myometrium. So it's not going to have this symmetrical or uniform enlargement of the uterus in the way that adenomyosis would. Finally, endometrial malignancy or hyperplasia can cause bleeding due to sloughing off of the deep endometrial layer. And both malignancy or hyperplasia are associated with unopposed estrogen exposure, and they're actually common in middle-aged obese females. And I just want to remind you that these conditions are covered in great depth in the lecture called Polyps, Fibroids, Adenomyosis, and Endometriosis. That's why we just made this review so brief here. But I wanted to review it briefly just so you could remember PALM, polyp, adenomyosis, leiomyoma, malignancy. Now here we see several masses protruding into the uterine cavity, consistent with endometrial polyps. And this is an image showing adenomyosis. Hopefully you can appreciate the area of endometrial tissue that's extending into the myometrium. Here we have an image showing several leiomyomas of the uterus, and pay attention to those large masses. And remember, those are smooth muscle. This photomicrograph represents endometrial hyperplasia, and take notice at these hyperplastic endometrial glands in this cross section. Okay, So we talked about the palm part of the mnemonic, which refers to structural causes of abnormal uterine bleeding. Now let's talk about non-structural causes. You can remember this using the mnemonic COIN. So let's start with C, coagulopathy. Coagulopathy, especially disorders of secondary hemostasis, can cause heavy menstrual bleeding. For example, von Willebrand disease is one of the most common inherited disorders that actually cause heavy menstrual bleeding. Ovulatory dysfunction, O, specifically anovulation, so the patient's not ovulating, can contribute to abnormal uterine bleeding. A good example of the type of abnormal uterine bleeding that would be caused by an anovulatory cycle is polycystic ovarian syndrome. Now let's move on to the E of the COIN mnemonic. This E refers to endometrial causes, but that's kind of strange because we just talked about structural causes of abnormal uterine bleeding, which included a lot of problems with the endometrium. But here, we're specifically talking about endometrial causes of abnormal uterine bleeding that are not structural. So we're really thinking about hormones as they relate to the endometrium. For instance, both hypothyroidism and hyperthyroidism can cause menstrual disturbances by interfering with the levels of prolactin, FSH, and LH. Or I, iatrogenic causes. Iatrogenic abnormal uterine bleeding usually results from surgical procedures like dilation and curettage, or myomectomy. And finally, we have the causes of abnormal uterine bleeding that are not yet classified. And just like we did for structural causes, we're just briefly touching on these non-structural causes because these are covered in more depth in another lecture called secondary amenorrhea. Okay, let's wrap up with a board-style question. A 37-year-old woman comes to the physician due to lower abdominal pain and heavy vaginal bleeding for the last 7 days. Her menstrual period started a week ago. She experiences similar pain regularly at the beginning of her periods. She and her husband have been trying to conceive for the last year, but her urine pregnancy tests are repeatedly negative. Her vital signs include a temperature of 37 degrees Celsius, a blood pressure of 110/80, a heart rate of 110, and a respiratory rate of 19 breaths per minute. Her laboratory findings are significant for low ferritin and low serum iron concentration. Her BMI is 22. The physical exam reveals an irregular, asymmetrically enlarged uterus with palpable masses. Which of the following is the most likely diagnosis of this patient? A, endometrial polyp, B, adenomyosis, C, leiomyoma, or D, endometrial adenocarcinoma? Feel free to pause the video while you consider the question. So this patient presents with heavy menstrual bleeding and regular lower abdominal pain during her periods. Her slight tachycardia and her high range of normal respiratory rate, low ferritin, and low serum iron concentration can be explained by iron deficiency anemia due to heavy bleeding. And on that physical exam, the uterus was enlarged but asymmetric, it had masses, it was irregular. That's classic for leiomyomas, also known as fibroids. Therefore, the correct answer is option C. This is the slide that we discussed earlier in the lecture, reminding us of structural causes of abnormal uterine bleeding. And the reason that we're focusing on this palm portion of the mnemonic instead of the COIN part is because on that physical exam, you could really tell that there was something structural going on. The uterus didn't feel normal. So your mind goes to palm, and then you think about these four. And out of those four, which are conveniently the options given in the question, leiomyoma, or a fibroid, is the correct answer. Let's now discuss why the other options are wrong. Option A, an endometrial polyp, is not correct because although it can cause abnormal uterine bleeding, and it's a structural cause, it does not cause an enlarged uterus, and it certainly doesn't cause palpable masses. Remember, these polyps are in the endometrium, so they protrude into the uterine cavity, so you wouldn't feel those polyps when palpating her lower abdomen. Option B, adenomyosis, is incorrect because although it can cause abnormal uterine bleeding, it's characterized by a symmetric enlargement, not asymmetric. And you wouldn't expect those discrete palpable masses in adenomyosis either. Finally, option D, endometrial adenocarcinoma, is wrong because she's a relatively young woman and has a normal BMI. And you really want to start thinking about endometrial adenocarcinoma in a middle-aged obese female. However, if leiomyoma wasn't an option, then option D, this endometrial adenocarcinoma, would be the best choice. But again, the correct answer is C, leiomyoma. And that concludes this lecture.